Hi there, my name is Dr. Invisible and I'll be taking care of you today. I've seen you before. Where have I seen you before? I did your cranial nerve exam a while back. How are you feeling? It's not good news that you're in, I suppose. I can see your eyes are very, very red. You have irritation around your eyes. Okay. Not to worry, we will take very, very good care of you, and I'm sure that we will sort out your eyes by the time you leave. Okay, not to worry. Before we start, I just want to confirm that your patient details are still the same. Do you mind just confirming your first and last name for me? And your first line of address, please. And is your phone number still the same? Okay, and your next of kin still the same? Okay, that's good. Now, what seems to be the problem? It seems you have a lot of information around your eyes, both eyes, I'm guessing. Yeah. Is it painful as well? Okay. So, not to worry. I would like to just examine your eyes, if that's okay. Okay, so is it okay if I just take a look at your eyes? Okay. I see a lot of redness. It seems there's some inflammation, particularly around the bottom of your eyes. Do you feel any sort of sensitivity to light or any blurred vision? A little bit, okay. And do you feel any pain or discomfort? Okay. So it does look inflamed. You can see a lot of redness actually, the more I'm looking. And do you think that you've been seeing an increase in the amount of discharge that you're getting from your eye? You know, sort of that white sort of gunk that you get sometimes. Is there more of that happening? Okay. That's probably your body's reaction to any sort of bacteria that's come into the eye. Okay. Do you want to just shine a light on your eye, if that's okay? Just to see how bad it is. Okay. So if you can just focus on my finger right here, and I'm going to look at your left eye first. Yep, so just focus on this finger. Okay, there is a lot of redness. Now, just can you follow my finger for me, please? Just up and down. Okay, that's great. Now, if you can do the other side as well, just focus on my finger again while I examine your right eye. Okay. Yes, both eyes have a lot of redness. Okay, now just focus on my finger and follow. Yep, up and down. Okay, so it seems that you have an equal amount of redness on both eyes. So I'm guessing that you have some sort of bacterial infection. So what I'm going to do is just use some fluids to hopefully just drain out whatever bacteria is still lingering there. now, just relax for me, okay? So this is just some antibacterial drops. Don't worry, there's no alcohol in it, so it shouldn't sting. What I want to do is just gently wipe just around your eye and hopefully clean any sort of discharge or debris around the area so that it can speed up the healing process, okay? So just look straight at me. I'm just going to clean the underside first. It's quite cool, isn't it? Yeah. Just relax for me, okay? Okay, now just the top side as well. Do you suffer from any hay fever at all? This could explain why you have so much irritation. No? Okay. Yes, it's now March and the trees are growing more blossoms, and now there's more sort of flowers growing and all the bees are starting to come out again. More pollination happens as well, and that starts to set off a lot of people's hay fever. So a lot of people come in with allergies and mostly, eye infections or runny noses. It's quite common actually. So I'm just cleaning, just focusing on the most red areas. I think the inner corners of your eyes have the most irritation. Yeah? Does it feel itchy as well? Yeah, it looks very itchy. Okay. So now, I just want to take this cotton bud and just get into the inner areas of your eyes, because I can see some discharge building up in the inner corners right here, and I just want to make sure that I clear that out before I put more drops in. Yeah, so I'm just going to spray the drops on again. Okay, now just look straight at me, just relax, don't worry, it shouldn't hurt. Just want to clear out all of that discharge and gunk around the eye. So the reason you're getting so much discharge is because that's your body's response to the bacteria that's invaded. So your eye is creating more gross stuff to hopefully push out the bacteria. So it's a good sign that your eye is working very efficiently actually. Okay, now the other side, just relax for me. Does that feel cool? That's good. Well, so far, all of your symptoms present as an eye infection, which is very easily treatable, so you shouldn't worry. A lot of them actually clear up on their own, but it's good that you came in. Have you had trouble seeing as well? Yeah. Okay. Now I just want to go in one more time with a cotton pad and just clear the area again. Okay, just relax for me. Just relax. Does it feel better already? Yeah. These eye drops are really, really good for itchiness as well. And a lot of the time, when people have eye infections, the reason that it gets even worse is because people end up just rubbing their eye, and that's because it's itchy. And I can understand, I know I'm supposed to tell you not to do it, but it's so hard when your eye is so itchy to not rub the area. So the reason that's bad is because it actually introduces more bacteria to the eye, so that actually makes the infection go on for longer. Okay, so it looks like I've cleared out most of the discharge and whatever pus was remaining. So far it just looks like you have basic bacterial conjunctivitis. That's just the medical term for eye infection. It could be a case of a viral conjunctivitis, but I don't think that it's that. You haven't had this before, have you? No. Another term for it is also pink eye, and that's because of the pink or redness that people present with when they come in. So you have a lot of redness as well. Yeah, but not to worry, it should clear up within a few days, okay? Usually it takes between 7 to 14 days maybe, and just make sure that you're properly cleansing the area. And I know it's really, really hard, but please try not to rub your eyes or scratch your eyes, because that's putting more bacteria into your eyes, and that will make the infection last longer. Yeah, so what I'm going to do I'm just going to prescribe you some eye drops. And just take this to the inpatient pharmacy. If you go down that corridor there, take a right and then another right, it should say at the top, pharmacy. These drops should last you between 3 weeks to 4 weeks. It shouldn't take that long for your infection to clear anyway, so it should be more than enough. If you do feel any residual pain, or the infection is not getting any better, or you're just experiencing more irritation, do come back in and we'll see you again. Okay. Well, thank you so much for coming, and I hope you feel better soon. And as always, if you feel any worse, please do come back in. Okay. Take care. See you next time.